I am Dr. Momo, your pain management specialist. I recently had a patient. Let's call him Mark. Mark spent 3 weeks doing cobra poses, hanging off a pull-up bar, and foam rolling his lower back until he was bruised. He was trying to fix a mechanical ache with nerve-related solutions while doing it the wrong way. He wasn't getting better. He was digging himself into a deeper hole. If you're stuck in a loop of pain and nothing is working, it's not because your body is broken. It's because you're fighting the wrong suspect or using the wrong tactics. Most of you think back pain is just back pain. But your spine is actually giving you a very specific map. That dull throb versus an electric-like wave. That isn't random. That is your anatomy telling you exactly what's going on. If you misidentify that signal, your rehab exercises might actually be making your injury worse. Today, we're going to open the file on the 3 most common back pain culprits so you can stop guessing and start healing. Enough guessing.
When it comes to back pain, not all aches are created equal. To fix the problem, you first have to identify the culprit. Think of mechanical pain as the rusty hinge. It's that dull, aching throb that fluctuates with movement. The kind you get from a lumbar muscle strain, a facet joint sprain, or simply from the postural fatigue of a long commute. When your back feels like a rusty hinge, your muscles and ligaments are screaming for stability. So stop sitting for 8 hours straight without a reset. Next, we have radicular pain, which I call the short circuit. This is the sharp, burning electrical wave shooting down your leg, often caused by sciatica, a herniated disc, or spinal stenosis. The truth here is that you are dealing with compression, not just tightness. Stop stretching. That's just picking at a scab. Instead, start focusing on decompression. Finally, there is inflammatory pain, or the morning grump. This is the stiff, constant ache that defines conditions like ankylosing spondylitis or rheumatoid arthritis. It usually feels worse at rest but begins to loosen up as you move. This is an internal fire. Your joints aren't looking for rest. They need movement early in the day to get properly oiled.
Important notice. While this profile helps categorize your symptoms, it is not a substitute for professional medical advice. Back pain can stem from various sources, some of which require urgent clinical attention. Please consult a registered healthcare professional to obtain an accurate diagnosis and a treatment plan tailored to your specific clinical history. If you experience any loss of bladder or bowel control, or numbness in the saddle or groin area, please seek immediate emergency medical care. What's next? Decoding your recovery. You've profiled the suspect. Now you need to understand the tactical response. In our next episode, The Rebuild, Principles of Movement for Your Profile, we are going to break down the general movement principles often used to support these pain categories. We will move past the guesswork and dive into the theory behind stability drills for the rusty hinge, the rationale for nerve-safe decompression for the short circuit, and the logic of early morning joint priming for the morning grump. Note, these are educational examples of movement theory, not personalized exercise prescriptions. Please consult with your healthcare provider to determine which movements are appropriate for your individual clinical diagnosis. If you're still trying to stretch out that nerve pain, you're literally making it worse. You can't stretch a nerve. You can only irritate it. We're done with the trial and error. Next up, the rebuild. I'm breaking down the specific mechanics you actually need to heal. Don't miss it. See you in the next one.